Good morning. I'm Colin Seeberger, Senior Advisor for Communications at the Center for American Progress. Welcome to today's panel and discussion on CAP's 2024 LGBTQI+ Community Survey. Today's conversation is so important. While the LGBTQI+ community has made tremendous strides over the last 2 decades, we know that the community is increasingly under attack from all angles. While these attacks ramp up, assessing the state of the community is both crucial and increasingly difficult as the Trump administration slashes research budgets and censors critical data sources. Independent research and analysis, like the CAP LGBTQI+ Community Survey, is critical to understand exactly what challenges are facing the LGBTQI+ community. Here at the Center for American Progress, we know that everywhere there are people, there are LGBTQI+ people, which is why our survey was designed to explore nearly every major issue we work on here at CAP. What we have found from this cross-issue work underscores what many of us have known all along. Policies that protect LGBTQI+ people, like protections from discrimination, access to paid family and medical leave, and healthcare protections support not only LGBTQI+ people, but families, women, low-income workers, and really all of us. This survey is nationally representative, meaning we were able to gather insights not only into those who take the survey, but into all adults across the United States. From this survey, we've measured everything from the impact of abortion bans on LGBTQI+ people to the rate at which LGBTQI+ adults use Medicaid, as well as how paid family leave would impact LGBTQI+ families. Today, experts from CAP will shed light on some of the key findings from our research series analyzing this survey data. Information is power. We hope that with this data, we can clarify the work needed and catalyze our progress forward. Thanks again for being with us today, and I'll now hand it over to Caleb Smith.
Hi all, my name is Caleb Smith. I am the LGBTQI+ Policy Director here at the Center for American Progress. Thank you so much, Colin, for those opening remarks. I'm really glad to have all of you joining us today. Before I hand it over to our panel, I have just a few quick notes. There is closed captioning available by clicking the captions button on the bottom of the screen. You can submit questions for our panelists at any point using the Q&A button at the bottom of your screen. There will be Q&A at the end of our panel discussion. A recording of the event will also be available after the event concludes on our website. We will have a few presentations today from Casey Doherty, the policy analyst on our Disability Justice Initiative, Haley Norris, our policy analyst on the LGBTQI+ policy team, Sarah Estep, economist for our Women's Initiative, and Molly Weston Williamson, our senior fellow for the Women's Initiative. I'll handle it over now to Casey Doherty, our Disability Justice Initiative policy analyst.
Thank you so much for the opportunity to share our findings with you today. My name is Casey Doherty, and I'm a white woman with dark blonde hair and a purple patterned shirt. This slide is titled Prevalence of Disability. It states that 48% of LGBTQI+ adults have a disability and 70% of transgender adults have a disability. This is what we learned from the survey. We also learned that 48% of LGBTQI+ people of color have a disability, as well as 66% of intersex people. This survey data is particularly important to share right now, as Colin was sharing against the backdrop of attacks on LGBTQI+ and disabled people's rights. 59% of disabled LGBTQI+ people stated that the recent slate of anti-LGBTQI+ bills make them feel less safe. This slide is titled Experiencing Discrimination and depicts a figure showing the percentage of adults who experience discrimination by demographic group and setting. The survey data revealed that disabled LGBTQI+ people face disproportionately high rates of discrimination across a wide range of settings. More than half of disabled LGBTQI+ adults reported experiencing some form of discrimination in the past year. This rate is nearly double that of non-disabled LGBTQI+ adults and disabled non-LGBTQI+ adults, and more than 3 times that of people who are neither disabled nor LGBTQI+. Discrimination was reported in public spaces at 36%, interactions with law enforcement 12%, and attempts to access government-funded goods or services like Meals on Wheels at 5%. In every listed environment, disabled LGBTQI+ adults reported higher rates of discrimination than all other groups. This slide is titled Income Disparities and depicts a figure showing the income of adults in the past year by demographic and income bracket. 33% of disabled LGBTQI+ adults reported a household income under $30,000 per year, compared with only 15% of non-disabled LGBTQI+ adults. To put these numbers into context, using the latest available federal data from 2023, 20% of all U.S. households had incomes below $33,000 that year, putting disabled LGBTQI+ households far outside the national norm. This could be a result of the employment discrimination disabled people face. Disabled LGBTQI+ people did, actually, if you could go back one slide, thank you. Disabled LGBTQI+ people did report significantly higher rates of employment discrimination at 30% than non-disabled LGBTQI+ people at 19%. 1/4 of disabled LGBTQI+ adults reported experiencing sexual harassment in the workplace in the past year. In addition to employment discrimination, disabled LGBTQI+ people faced high rates of discrimination in education. More than 1 in 5 disabled LGBTQI+ adults reported experiencing discrimination in school settings. That's more than double the rate for disabled non-LGBTQI+ adults and over 4 times that of adults who are neither disabled nor LGBTQI+. Comparatively, in 2020, 25% of disabled LGBTQI+ adults reported discrimination in the school environment. So that number has gone down a bit to 21%, which is good news. Non-disabled LGBTQI+ and non-disabled non-LGBTQI+ adults were also more likely to report having a bachelor's degree or higher compared with disabled LGBTQI+ adults. A contributing factor to these disparities may be a lack of financial resources, as we can see on this slide. Disabled LGBTQI+ adults are nearly twice as likely to receive federal financial aid, such as Pell Grants, than their non-disabled LGBTQI+ peers at 19 versus 10%. This slide is titled Social Safety Net Benefits and shows a figure with the percentage of adults receiving government-sponsored benefits in the past year by demographic group and type of benefit. Disabled LGBTQI+ adults indicated they are more likely to receive government safety net benefits. They were nearly 2.5 times more likely to report receiving unemployment benefits than disabled non-LGBTQI+ people, non-disabled LGBTQI+ people, and people who do not identify as disabled or LGBTQI+. As this figure shows, when compared to all other demographic groups, disabled LGBTQI+ adults were more likely to receive benefits from the Supplemental Nutrition Assistance Program, Temporary Assistance for Needy Families, and the Earned Income Tax Credit. However, they were slightly less likely to receive Supplemental Security Insurance, or SSI, than disabled non-LGBTQI+ people, which may be due to the increased administrative burdens required to apply for these benefits. SSI, unlike the other benefits listed here, requires an individual to be evaluated for disability status and requires an application process that can take years to complete. This slide is titled Healthcare Access. It states that 31% of disabled LGBTQI+ adults reported postponing or not accessing medical care when they were sick or injured due to disrespect or discrimination from healthcare providers. They reported double the rates of disabled non-LGBTQI+ people in postponing or not getting medical care when sick or injured because they could not afford it. Disabled LGBTQI+ people were also significantly more likely at 46% than non-disabled LGBTQI+ people at 22% to report wanting to see a therapist or mental health professional, but not being able to afford it. New anti-LGBTQI+ laws have made it difficult for disabled LGBTQI+ people to obtain treatment. 8% of disabled LGBTQI+ people reported being denied gender-affirming services due to recently passed laws restricting access to medical care, compared to less than 1% of non-disabled LGBTQI+ people. Anti-abortion laws also made it more difficult for disabled LGBTQI+ people to receive reproductive care. Disabled LGBTQI+ people were more likely than all other groups to not be able to access abortion. Of those that did receive abortion, reproductive care, or maternal care, disabled LGBTQI+ people were more likely to have to travel to another state to receive that care. Disabled LGBTQI+ people face significant discrimination when attempting to receive care. They were more likely to have a healthcare provider intentionally refuse to recognize family or have healthcare providers refuse to see them due to religious beliefs. Disabled LGBTQI+ people at 25% were also more likely than non-disabled LGBTQI+ people at 9% to feel uncomfortable speaking about their sexual orientation, gender identity, or intersex identity to their therapist or mental health counselor. Health insurance companies also seem to discriminate more against disabled LGBTQI+ people. Disabled LGBTQI+ people were more likely to be denied gender-affirming surgery at 12%, when compared to non-disabled LGBTQI+ people, less than 1%. Health insurance companies were also more likely to deny gender-affirming hormone therapy to disabled LGBTQI+ people at 15%, in comparison to non-disabled LGBTQI+ people at 2%. Disabled LGBTQI+ people were also less likely to have health insurance than other groups. And I know Haley will speak a little bit about that next. Before I pass it over, I'd love to share a few policy recommendations aimed at addressing the disparities I discussed in advancing equity. I'll share a couple of ideas now, and you can check out our report for the rest of them. We advocate for reestablishing and protecting sexual orientation and gender identity, or SOGI, data. A few days after Trump signed the executive order titled Defending Women from Gender Ideology Extremism and Restoring Biological Truth to the Federal Government, SOGI data began to disappear from government websites. This data is critical for understanding and addressing health disparities and improving healthcare quality for the LGBTQI+ community. Legislation could require federal departments to reestablish the lost SOGI data and ensure it's included in future federal data collections. The disability justice is also very focused on strengthening and expanding access to Medicaid. In 2023, at least 15 million disabled people relied on Medicaid. More LGBTQI+ people are enrolled in Medicaid than non-LGBTQI+ people, showing that it's very, very important at this intersection. And it's estimated that the Republicans recently passed One Big Beautiful Bill Act would cause 10.5 million people, many of whom have a disability, to lose their Medicaid coverage by 2034. It's essential that policymakers reject Medicaid cuts. 10 states have yet to expand their Medicaid programs. Legislators in these states should expand their programs so more people are eligible for coverage. Policymakers must also increase state Medicaid reimbursement rates to help increase provider participation. Thank you for the opportunity to share our data. I want to flag that the Disability Justice Initiative published a report just this morning called The Trump Administration's War on Disability. We summarize the many actions the Trump administration has taken since January that have disproportionately affected the disability community. That report will be shared with you, and I encourage you to check it out. I will pass it over to Haley next.
Thanks so much, Casey. Hi, everyone, and thank you all for your patience as I am controlling the slides and sharing things on screens. I'm going to talk about the insurance coverage rates that we have from our survey. And I want to start with sort of the biggest top line, which is even though LGBTQI plus adults are underinsured at a higher rate than non-LGBTQI plus adults, we see that that uninsured rate has remained relatively stable over the last few waves of the CAP Community Survey. So it's hovered around 13 to 16% for uninsured. And we have seen some improvements for select groups, namely for trans people. So in 2022, the uninsured rate was 22% for trans folks. And in this most recent survey for 2024, we see that that has gone down. So that's really great. And it shows us that non-discrimination policies and insurance requirements can be helpful and can improve access to healthcare. When we look specifically at the types of insurance that LGBTQI people had, there's some really important findings and interesting sort of differences. So most LGBTQI plus people have insurance through an employer-sponsored plan, whether that's their own employer, a partner's employer, or a parent's employer. And it's actually the same rate as non-LGBTQI people, so 37% for both groups. But remember that this is 37% of the insured population, and there's a difference between LGBT and non-LGBT insured percentages within those groups. The other reason that this is really interesting is that private insurance is really regulated at the state level. So there are lots of opportunities for policymakers and advocates to improve coverage and improve non-discrimination for employer-sponsored plans. The other kind of big highlight that we found in this data is the difference between coverage through Medicaid. So for non-LGBTQI adults in 2024, only 13% of the insured population was covered through Medicaid. But when we look at LGBTQI plus adults, that number is higher. 19% of the entire insured LGBTQI plus population had Medicaid coverage. And it's again even higher for trans adults. 28% of all insured trans folks had Medicaid. And it's also higher for LGBTQI plus people of color and for disabled LGBTQI plus people. We know that LGBTQI plus people have a harder time accessing healthcare due to costs and fear of discrimination. So this is, data that we published in our initial report earlier this year showed that 1/3 of all LGBTQI plus people avoided needed care, so care when they were actually sick or injured, due to costs. So those cuts to Medicaid that went through the One Big Bill Act are going to be really detrimental to LGBTQI plus people's health. Not only is the administration taking away funding, taking off millions of people, but their anti-trans and anti-DEI work are going to make it more difficult for everyone to receive safe, equitable care at the doctor's office. And CAP has a lot of really excellent work covering harms to specific groups like women, in relation to these funding cuts. And our report had a few additional data points about insurance denials for certain types of care. And two things that I wanted to highlight before I pass it over is that 1 in 10 trans folks were denied HRT through coverage through their health insurance. And then we also saw a pretty clear difference amongst same-sex couples who were seeking various fertility treatments. So for LGBTQI plus people of color, there were higher rates of insurance denial for various services. Even though these, data points and rates of denial are frustrating, it does give us some hope because it shows once again that non-discrimination protections can go a long way to improving people's access to care that they deserve and need. I'm really happy to talk more about those things during the Q&A, but for now, I'm going to hand it over to Sarah to talk about the wage gap.
Hi, everyone. I'm going to be talking about the LGBTQI plus wage gap. We got a ton of great data in this new survey, and so we were finally able to analyze what I believe is the most recent version of the LGBTQI plus wage gap that exists right now. So we found that there was an 85% gap between all LGBTQI plus households compared with non-LGBTQI plus households. And that resulted in an annual loss of nearly $12,600 a year. So As you can see, based on this analysis, these gaps even grow wider whenever people have multiple intersecting marginalized identities. So the gaps were wider for Black LGBTQI plus households, who only made 61% of what non-LGBTQI plus white non-Hispanic households made. And that results in a loss of $33,700 a year. So we're talking about really huge sums of money here. If we advance to the next slide, I'm going to talk about how these nominal amounts compare to other data that's out there and how our survey differs from publicly available data. So in our survey, we actually ask sexual orientation and gender identity questions, as well as sexual characteristic questions, otherwise known as SOGI data, that allow us to identify if people are LGBTQI+, and that is very different from how we use publicly available data like the Current Population Survey or the American Community Survey, where we can only see if people are LGBTQI+ if they are cohabitating or married to a same-gender spouse. So we really have very limited data there, and that means that we're mostly looking at dual-income households whenever we look at that data. Our data also includes single income households or people who are single. And that is why you may see a big difference in the gaps. And we're talking about households here. So as you can see, there are significant gaps for LGBTQI plus women. There are also large gaps for trans people and people of color. Now, there are a few contributing factors to the wage gap that we usually talk about. Those include things like years of experience, different occupations, and other things that may be driving the gap. In our survey, we ask people to disclose their sexual orientation and gender identity, and that has resulted in generally a lower age band for the LGBTQI plus population compared to the non-LGBTQI plus population. Whenever we're looking at younger people, they tend to have fewer years of experience and be concentrated in different occupations than older people. So that could explain a portion of this, but we also see huge differences in discrimination across LGBTQI plus people compared to non-LGBTQI plus people, which is also driving that gap. If you flip to the next slide, you can see how LGBTQI plus populations compare to non-LGBTQI plus cisgender heterosexual men. And as you can see across the board, these groups tend to skew lower income and have fewer people within the high income band. In general, the largest gaps were for non-binary people. You see 43% of non-binary households made less than $30,000 a year. And to put that into perspective, that is about the threshold for poverty for a family of 4 in 2024. So that is a quite low income for a household. If we switch to the next slide, I'm going to talk about some of the policy implications for wage discrimination enforcement and harassment and sexual harassment enforcement in the workplace. So in 2020, Bostock versus Clayton County, which was a Supreme Court case, clarified that employment discrimination on the basis of sex included sexual orientation and gender identity, and that enabled our enforcement agencies to prevent discrimination for LGBTQI plus people across the country. The agencies that I'm going to be talking about are the EEOC and OFCCP, and they have currently been under attack by the Trump administration. We currently do not have a quorum at the EEOC, which means they cannot issue any guidance or remove existing guidance until they have that quorum. Currently, there is someone on deck, Brittany Panuccio, who could be confirmed and produce a quorum. And we already kind of know what things the EEOC is going to go after when that happens. So Chair Lucas has already indicated that some of the first things they'll be going after are the harassment guidance, which was updated in 2024 to clarify guidance for employers related to sexual orientation and gender identity. Already under EO 14168, that was the EO that Casey talked about earlier on in this presentation. That has already had a few things happen without quorum. They have already removed various training materials from the website related to sexual orientation and gender identity. And they've removed the X gender marker from the intake process for discrimination claims. So we're really in a difficult place right now in terms of our employment discrimination enforcement apparatus. For federal contractors, suppose you are building a federal courthouse, you would be covered by the OFCCP much more broadly than individuals who don't work for a federal contractor. And EO 11246, which allowed the government to go in and audit federal contractors and prevent them from taking on further government contracts if they were really severely violating non-discrimination policies. That has been revoked by the Trump administration and has essentially defanged the OFCCP from a lot of their enforcement capabilities. So I'm sorry to leave it on this note, but when we are in a situation where we have a more progressive administration, these should be some of the first agencies that we focus on building back up so that everyone should have employment protections. So I'm going to pass it along to my colleague Molly, who is going to talk about paid leave and caregiving.
Thanks, Sarah. I'm Molly Weston Williamson, and I'm a senior fellow at CAP. And one of the things that's really exciting coming out of this particular survey from CAP, which is now in its third iteration, is data that doesn't really exist anywhere else. And one of the aspects of data that really this is sort of the only game in town for is really understanding how LGBTQI plus adults compared to non-LGBTQI plus adults are taking time off from work or needing time off from work. And so in this year's survey, we asked respondents about whether in the last year they had taken time off from work for a range of health and caregiving needs for their own health, to care for a range of loved ones. And what we found on question after question over and over again was that LGBTQI plus people were more likely to report having taken time off from work, in some cases dramatically more likely to report having taken time off from work for that reason than non-LGBTQI plus people. And what that really tells us is that sort of across the board, across a range of health and caregiving needs, LGBTQI plus adults are more likely to report having taken time off from work. And that connects to some of what we see in other areas. So like what we see about discrimination in accessing healthcare, as Haley spoke to what we see about the particular needs of LGBTQI plus disabled adults, as Casey was talking about, and where there are some particularized results. But when we think about the public policy implications, we connect this with what we've seen in other parts of the survey results, so particularly in the first piece in the series. Because what we know is that while LGBTQI plus adults are more likely to take time off from work, they're also more likely to work in kinds of jobs that are unlikely to provide access to paid leave. Because what we know across the board is that discrimination constrains LGBTQI plus adults' choices in terms of work. That many LGBTQI plus adults are making decisions about where to work in order to avoid discrimination, including most trans adults. And we know that that desire is rooted in very real and pervasive experience of discrimination. So just in the last year, in the survey results, 1 in 6 LGBTQI plus adults reported having been fired or not hired because of their LGBT status, including 1 in 4 LGBTQI plus people of color. And so in this context of this pervasive discrimination, in the context of these reduced and restricted choices, LGBTQI plus people end up concentrated in kinds of jobs that are unlikely to provide paid leave in ways that feed into things like some of the wage gap information that Sarah was just highlighting. So we know that LGBTQI plus people are more likely to work part-time, they're more likely to work food service, they're more likely to work retail. And what we know from other data sources like BLS data is that those are kinds of jobs that are especially unlikely to provide all kinds of paid leave. So part-time workers are much less likely to have access to even short-term paid sick time. They almost never have access to paid family leave or short-term disability insurance. Retail and food service are typically low-wage industries where there's very limited access to all forms of paid leave. And when we connect these pieces together, the story we end up with is one in which LGBTQI plus adults are more likely to take time off from work for health or care needs, but also more likely to work in the kinds of jobs that typically don't provide access to paid leave. And so when we think about public policy solutions, what that really underscores is that when we pass universal policies that guarantee workers the right to paid sick time, including part-time and low-wage workers, that guarantee workers the right to paid family and medical leave for extended or serious health or care needs, LGBTQ workers stand to disproportionately benefit and are particularly benefiting now in the large and growing number of states and cities that are guaranteeing these kinds of protections. The survey results also tell us, as we move to the next slide, more about what we need those policies to look like to really meet LGBTQI plus adults and families' needs. The survey looks at who are the people that all kinds of adult respondents in the survey either count on or expect to count on or are counted upon by for care when they have a covered kind of health need. And in particular, one of the areas where this survey has been a particularly important data source is in understanding the impact of care for chosen families. So loved ones to whom people may not have a legal or biological relationship, which could be a friend who's like a sibling to you. That could be someone with whom you've taken on a parental or grandparental relationship. Chosen family could also include a partner to whom you are not legally married or don't have a registered domestic partnership. And what the data really underscores for us is that if we're not designing policies around caregiving, policies around time off from work, whether we're talking public policy solutions or an individual employer policy, to explicitly and thoughtfully include chosen family, we're not meeting LGBTQI plus adults' needs. So in the survey, I want to highlight just two statistics here, but there's a lot more data on this in the piece. Among LGBTQI plus adults, 50% report having called on chosen family for support with a health-related need. And that just really, really underscores the extent to which we need, as we do have as a best practice and in a growing number of state and local policies, but also in the work towards the federal guarantees that we know we need in terms of paid leave and that CAP continues to advocate for, the need to thoughtfully and deliberately include care for chosen family in order to meet the needs of LGBTQI plus people. That 50% number, I think, is really salient. When you ask people who they have been called upon by, so has someone else who is in your chosen family called on you, that number is actually even higher. So really, we're talking about fundamental kitchen table, day-to-day, are people able to take care of the people that they love? And I think to go back to Colin's earlier point about how when we pass thoughtful universal policies that particularly benefit LGBTQ people, but also really sort of benefit people across the board, the second statistic here really drives that home. Because while a lot of research and work around chosen family specifically comes out of an interest in LGBTQI plus justice, we also found that a third, so 33% of non-LGBTQI plus adults reported having called on chosen family for support. And so while here we see a gap, right, we know that inclusion of coverage for chosen family in leave and caregiving policies is especially important for LGBT adults. We also know that it's important across the board. And that relates to ways in which we've seen other kinds of important impacts of care for chosen families. So for example, we know that veterans are disproportionately likely to rely on chosen family for care. We know that chosen family care is particularly important for people with disabilities. And so what this data really points us to, particularly this comparative information, is the need to work towards comprehensive, inclusive policies that really meet all people's needs while providing particular benefits to LGBTQI plus adults. And with that, I'm going to turn it back over to Caleb to move to Q&A.
Thanks so much. Those presentations were so enlightening, and I really appreciate everyone's detail and thoughts and analysis to bring everybody this really incredible and insightful data. We're going to shift over to just an open-end conversation and Q&A section. So folks, please put any of your questions that you might have about the survey or for our panelists today in the Q&A section at the bottom of your screen. You should be able to select and go ahead and answer any questions you might have. I'm going to start with one of our questions here. How do folks' findings, this is for everybody, it looks like, how do your findings line up with what you know of other assessments or surveys we've had on topics that were similar to the ones that you discussed today?
Go ahead. I was just going to go in order of presenting, but if you've already got some, Sarah, jump in.
Well, I was just going to say I already kind of touched on this, but like whenever we're looking at data sets that are publicly available, we're often looking at partnered households or married households whenever it concerns the LGBT plus community. So that is one way that our data is going to differ from any kind of census analysis. So I think that's important to point out. For other groups of people, another stat we commonly produce is the gender wage gap for all women compared to all men. That's 75 cents on the dollar. So it looks a little bit lower than the overall LGBT plus population. But in general, marginalized groups tend to face higher wage gaps. So I'll pass it back to you, Haley.
I think I touched on this too, but the uninsured rates have been pretty stable when we look at the LGBTQI plus community as a whole. And I think that is good and bad, right? It's good because there was actually a pretty significant bump in terms of insurance coverage rates following the Affordable Care Act. And it's bad because it means there's more work to do, but that's what we're all here for. So figuring out how to reach those last 13, 14% of folks is really important. I think the other over time comparison that's useful to look at is coverage denials for trans folks specifically. And this is useful and important mostly because the current administration has put out some materials claiming that private insurers don't cover this kind of care. And when we look at the rates of denials for HRT or for gender affirming surgery, we see them going down over time, which means that insurance companies are covering them more frequently. So I'll pass it to Casey for her next thoughts.
Thank you. Yeah, I would say generally our findings at the intersection of disability and LGBTQI plus identity did line up, I would say, with other assessments. In many ways, it was just like a super comprehensive update, about the status in 2024. I can share a couple examples. So our findings about household incomes, I would say, do line up with other assessments. The Center for Research on Disabilities 2025 Annual Disability Statistics Compendium showed that disabled workers have lower household incomes than non-disabled workers. And then, as we've discussed, Sarah and Haley's research indicates that LGBTQI plus workers often have lower household incomes than their non-LGBTQI plus peers. And then I'd also love to share, I didn't get a chance in my section to talk about housing, but we also see a lot of disparities there. So I'll share a little bit about that. We learned that disabled LGBTQI plus adults were much less likely to report owning or purchasing a home in 2024. At 49% compared to 66% of disabled non-LGBTQI plus people, 60% of non-disabled LGBTQI plus people, and 74% of non-disabled non-LGBTQI plus people. So then looking at similar data, home ownership for disabled LGBTQI plus adults is up from 2019 when CAP analysis of data from the 2019 Behavioral Risk Factor Surveillance System showed that while 74% of non-LGBTQI plus people without disabilities own their homes, 41% of LGBTQI plus people with disabilities did, including just 30% of LGBTQI plus people of color with disabilities. So we found that it was 49% home ownership in 2024. So that is up 8%. Now we know that, folks are still experiencing housing discrimination at disproportionate levels, but that home ownership percentage is up a bit.
And I think close up on this one. I think what we've seen here is particularly helpful to compare mostly to other CAP data from the survey, because that's really where the leading information is on use of workplace leave and on caregiving. This is the first year in which CAP has published results on use of time off between LGBT and non-LGBT people. Previously, the last main resource that folks are referring to that had specific data on LGBTQ people and leave usage was a 2018 report, and 2018 is a long time ago. In terms of workplace laws and needs, in terms of progress for LGBTQ families. And so this data really comes at a particularly valuable moment. When it comes to the family caregiving relationships, which is something that CAP has really been building the field on for a long time, the numbers are remarkably stable. So for example, if you compare the statistics on what percentage of people are calling upon or have been called upon by chosen family, what percentage of people say that an unmarried partner, for example, would be their first call versus other kinds of family members, what we see is numbers that look remarkably similar. The numbers on basically every axis from the 2022 survey and the 2024 survey for both LGBTQ and non-LGBTQ people are all within a couple of percentage points. They're within sort of general statistical wobble. And I think what that really underscores is people have needed time to care for chosen family forever. And public policy is slowly catching up to families' realities. But we know what we really need because we see such stable results, that we need more. We need to better reflect that. We need to make sure that we're seeing public policy catch up to what we know from the data, particularly for LGBTQ families.
That is all super helpful. Thanks, everybody. A little bit on this track, and Sarah, I think you've kind of alluded to this a little bit. There's a question about when you're analyzing data about wage gap, was there differentiation or analysis around variation in age or in household type, such as single income or dual income? And could you also talk a little bit about the language itself of wage gap versus, for example, income gap or something like that?
Sure. So I'll touch on the last point where I'm using this interchangeably. It's probably better to say income gap whenever we're talking about this data because we're talking about household incomes, but generally people search for gender wage gap whenever they're thinking about this data. So I want to touch on marital status a little bit. There's other survey analysis. We didn't produce a figure on this, but there's other survey analysis from places like Gallup that poll the LGBT plus community, and they find that there are lower marriage rates for LGBT plus people than there are for non-LGBT plus people, and ours looks pretty similar to that. So I want to say, when you're looking at married households, and we look at this in the census data, they tend to skew higher income because they tend to be dual income, and they tend to have higher levels of education generally, people who are married, and they also just generally have different factors like age that make them tend to earn more money than unmarried households. And so whenever we're talking about these wage gaps, that is a factor that is driving the wage gaps. We're not controlling for that here, but we don't control for that in other gender wage gap analysis that we do either. So for the wage gap for all women compared to all men that I just talked about at the end there, we don't control for the fact that women are more likely to be widowed because they live longer, for example. So like this generally is not something we've controlled for in the past in this analysis. So I think it's worth noting that like whenever academic studies have been done on the gender wage gap and they have controlled for various factors, they've generally always found this unexplained portion that is due to discrimination. So I want to note that that's definitely a factor that's driving gaps for LGBT plus people whenever we see such high rates of discrimination for them in the workplace across the board. Maybe Haley can talk about that analysis a little bit more because I know you looked into the discrimination data.
I can, but I also know we have a number of questions. I don't know what works best for you.
Sure, let's go. Yeah, let's check in on a couple of these other questions that folks have, and then if we have time, we can circle back. Another question from the audience is, did y'all notice anything interesting about the way LGBT students pursue education and experiences particularly related to LGBT students?
I'll start, and then Casey, I know you have some education data you might want to add. The first thing is that LGBTQI plus folks are either the same level of education or more educated than non-LGBTQI plus folks. And this is from our first report that came out, I believe, in March. So if you're interested in looking into that, we put some of that in there. And as Casey also pointed out, LGBTQI plus folks are more likely to receive federal assistance like Pell Grants. When it comes to like the levels of education, there are differences amongst racial and ethnic groups that I think are really important to highlight. But overall, when we think about education and connect it to things like income and insurance coverage, what sticks out for me is that LGBTQI plus folks are educated enough to have higher paying jobs. And they're still forced to operate in a world where they experience workplace discrimination that causes them to choose jobs, as Sarah mentioned, and as Molly mentioned, that may pay less or have less access to benefits.
Yeah, I can jump in here. So I did share a little bit about, the disparities that disabled LGBTQI plus folks report in school settings. We found that more than 1 in 5 disabled LGBTQI plus adults reported experiencing discrimination in education. And I did share a little bit about, the education levels. Disabled LGBTQI plus adults were slightly more likely to not have completed high school or the equivalent than other groups. I'll share too, I don't think we looked at this, but Haley, correct me if I'm wrong. Generally, disabled students are more likely to enroll part-time in college, for instance. I don't think we looked at that in particular in this survey, but that is something important to note when we think about receiving, financial aid or federal benefits. So yeah, happy to take additional questions on the education front, but I think that's enough for now since we have other questions.
I appreciate that. Thank you. I've gotten a couple questions in here, I think more globally around disaggregation of data, around, for example, breakdown of the different types of disabilities folks may have, or different racial identities, and breaking down beyond simply a POC designation. I think these are really, really good questions, and so I want to make sure we take a sec. It is so important that we are working and partnering really directly with all of the different teams here at CAP, including our disability justice team, our women's initiative team, our racial equity team, our immigration team, and folks across the different departments. However, for a lot of these particular identities, it's hard to narrow in further while still maintaining the type of data confidence that we need to be able to apply this data across populations. So I acknowledge that there's so much more data to gather, and certainly there are some limitations. When we are capturing, the survey had about 3,600 participants in the survey, which is enough for us to be able to be nationally representative of populations like LGBT folks and trans folks in some areas, and intersex folks in particular in a lot of areas, which we're very proud to be able to include intersex folks there as well, and some levels of different types of disability and race and ethnicity. So is there anything that folks would like to add to desegregation and being able to kind of look into the data at that level?
I can jump in and add a little bit. I know we got a question about looking at what types of disabilities were represented in the survey. So people did not describe their specific disability to us, but they were able to select their disability category from a list. So I can share a little bit about the breakdown, and you can also find a very helpful chart in that report that I think was shared during my presentation earlier at 11:04. So if you go up in the chat, it's in there. So we found, I mentioned this at the top of my presentation, but 48% of LGBTQI plus adults reported having a disability. And I can share a little bit of the breakdown. So 10% of those were a physical disability, 3% communication disability, 4% deaf or hard of hearing, 5% blind or visually impaired, 13% chronic illness disability, 6% cognitive or developmental disability, 24% mental health disability, 14% emotional or behavioral disability, 7% learning disability, and 3% was the category other disability not listed here. And you can also see a breakdown. We look at folks disabilities who are trans, intersex, and LGBTQI plus people of color. You can see all of those breakdowns in the report.
I'll just add, I really appreciate the questions about disaggregating the data further and really honing in on, trans communities of color or doing maybe more detailed comparisons by gender. I think that's kind of the best part about presenting data, is that good data should inspire more questions, right? We should look at a data point and then say, okay, and tell me more. So I'm receiving those questions kind of in that vein. And I also think that getting that kind of feedback from folks as we present is useful as we think about what to do next. Other information gaps are out there. Because our goal with this data is, as always at CAP, to really, figure out what the on the ground experience is and then devise solutions for those lived experiences. So I just appreciate those questions. Thanks, y'all.
Yeah, absolutely. And thanks for those insights as well. I appreciate it. There's a question here about how we see the survey changing in the future. And I think, as kind of Haley alluded to a bit, we get to kind of shape this survey moving forward. And we've done this, this is our third of these. This is the third wave of this survey. And every time we get a little bit better, I think, at asking the right kinds of questions and speaking to the challenges we have in capturing certain types of data. And so events like this are helpful in determining what kinds of questions we should be focusing on and survey design in general. I'm curious for the folks here, what are questions that you're thinking of as we look towards collecting data, potentially even in just a few months here for our next round of surveys?
I'd love to hear from Sarah or Molly.
I would love to see maybe a union status question. I think that would be really interesting. I think it would help us kind of understand wage gaps a little better. The survey is already so comprehensive. I'm hesitant to say how much we should add to it, but I think that's one big thing I would love to see. Molly, do you have anything?
You can tell who on this call is a real data researcher and who isn't, because I'll just add lots of things to the list. I think we have really incredible information here about how LGBTQ people are taking time off from work. What we don't know from the data we have is what the need is. We know that there's some number of people who need time off from work for these same needs and aren't taking it. Whether that's because they can't afford to lose the paycheck, whether that's because they're worried they're going to lose their job, whether that's because they're worried that taking time to care is going to involve outing themselves because of the kind of caregiving relationship or the health need. And so I think pairing the questions about what kinds of time off from work people are taking with questions about where the need is, and if there has been a time where people have needed time off from work for those reasons and haven't taken it, I think would be really intriguing. I also think there's room, and again, I think this is because this is a really wide open data field, where really we're sort of relying on informed conjecture about kinds of work and what that means for paid leave status and that 2018 study. I think more information about specifically access to paid leave or lack thereof, particularly for LGBTQI plus people, could be really interesting. I think we have a lot of informed hypotheses based on kind of work that I'm sure are useful for understanding the overall trends, but I think there's more to do, again, because there just aren't a lot of robust, nationally representative LGBTQI plus surveys. There just aren't, and particularly not that have this kind of comparative heft. And so where there's room to build that out, I think there's a lot of value there.
I have two things, and someone in the Q&A already threw it out there, so I'm just gonna double down on add some questions about connections to the criminal justice system. I also would love to make it even more complicated for us to analyze by adding in some open-ended responses, particularly around maybe discrimination experiences. And then the last thing kind of building off what Molly just said is, we have questions that we've reported out the data for, again, in the first report about, rating mental and physical health. But I think it could be great to see folks rate other things, right? Like access to food, access to, or sort of quality of housing, things like that. But, I'm a data researcher who knows that when you add a question, it usually means you have to take out a question. So I say those things aspirationally. But yeah.
And we've got just a few more minutes left here, so I'm going to jump in and see if we can get maybe 2 questions in. But we're going to start with this one, and it's generally about the self-reporting of LGBT identity, and particularly as we are entering a space where there's even more rightful fear and concern about how and when folks are publicly or in some sort of survey identifying as LGBT, how do we grapple with collecting this data, and how do we work with self-reporting identity? And I'm going to hand it over to y'all to answer some of this too, but something to note for this survey is that we work with NORC, and NORC helps carry out this survey, and that includes reaching out to identified participants. So this survey is not necessarily one where folks can opt in and find the survey and then fill it out. We work with a partner who reaches out to folks to make sure that this survey is representative as best we can of LGBT folks, of Black and Brown folks, of folks with disabilities in relation to the U.S. population, and so that we make sure that we're sampling correctly to what we know as best we can, right, of population estimates. So that helps a little bit with ensuring that we're getting the right numbers of folks, and there is still obviously self-reporting error that's possible. So I'm curious if folks have any quick thoughts on that.
I'll be quick, I promise. I think the important my response is actually advice. So if you're working in community orgs or with partners and folks are wondering, is it safe for me to reply to this? Is it safe for me to give this kind of information on the survey? I think there's a difference between who holds the data itself. So for us, we hold the data, it is not shared. And when you're looking at surveys run by, those kinds of like private research projects, I think those are safer in terms of data protection and exposure. So I would encourage folks to continue to participate because the federal government is erasing and or stopping collection on SOGI data. The age thing is kind of a perennial LGBTQI plus problem. And I don't really see it as a problem. It's, there are ways to kind of look at data and see what's not being reported. That's like the feminist approach. What's missing? Okay, let's figure out what that silence says. So I'll let other folks chime in, but my advice is really just do like a risk management for yourself on who has your data.
All right, I think we can squeeze in one more question. I think we can try. All right. And this is about mental illness and capturing folks there. Is there any data that focuses on LGBT individuals with a serious mental illness, like access to housing or care or anything like that? And if folks have thoughts on that piece of the data.
Casey, do you want to talk about how the disability category kind of captures that?
Yeah. So, like I was sharing, the breakdowns that we do have about the types of disabilities represented. We've got here that 24% of all LGBTQI plus respondents had a mental health disability. Now, kind of harkening back to the question about like, what would we like to see about this survey going forward? Like, I think it would be great to have just like more options, and I don't actually know how this would work, but if people could like name their disability themselves, because having them in categories, we know that we're probably going to miss some people because they may not see themselves represented in those disability categories. In terms of, mental health disability is a very wide range. It's a very big category. So I do wish we could see some additional breakdown there. But I can share too a little bit more about that mental health disability category. So we're seeing that for all non-LGBTQI plus respondents, only 7% had a mental health disability. So I'll kind of go through. So it's 7% of all non-LGBTQI plus respondents, 24% of LGBTQI plus respondents, 49% of trans respondents, 15% of intersex, and 21% of LGBTQI plus people of color. So that provides some knowledge into what we're seeing in terms of that category, but we didn't do any additional kind of breakdown there. I would love to see it someday, though.
Thank
Haley,
you.
you have anything to add, or Cal?
Perfect. Well, thank you so much for adding that in. And with that, I just want to say thank you again, everybody, for joining us today. And thank you to our panelists for sharing your insights and for providing all of this great data. So we'll have a recording available after we conclude on our website. And thank you all again. Have a great rest of your Monday.